Well, good morning, everyone. Thank you very much for joining us today. I'm Oliver Yandel. I'm the Executive Director of ALA. And with me today are Teresa Walker, ALA's President and also COO of Waller, Lansden, Dortch & Davis, LLP, Alan Wilson, and Charles Carlson of GLJ Benefit Consultants. As you may know, ALA announced a new member benefit program at the annual conference in Nashville. And as legal management professionals, you and your management teams have had to deal with lots of challenges relative to healthcare, as you well know. Rising premium costs because of changes in the healthcare laws, the overuse of urgent care or emergency room visits to deal with relatively minor issues which lead to increased premiums, absenteeism due to employees needing to take time off of work for doctor's appointments, either their own or their child's or sometimes even elderly parents. And your employees are facing challenges as well. Getting appointments with primary care physicians for minor or routine matters is increasingly difficult. And when your staff members are on the road and need a simple prescription or a consultation, they often have to wait until they get home to see a doctor, and that adds even more time out of the office. So to help with these challenges, ALA has partnered with GLJ Benefit Consultants to offer a new program. It's called Teladoc, and Teladoc is the leader in telemedicine. It allows users consultation with U.S. board-certified doctors who can diagnose, recommend treatment, and prescribe medication for many medical issues, either over the phone or through a video conference. So not only does the program save patients time and money, it can have a major positive impact to your bottom line in the way of reduced absenteeism, savings on healthcare premiums, and improved productivity. For just $7 a month per employee, your employees and their entire households have access to medical care 24 hours a day, 7 days a week, no matter where they might be. So not only is the program a great advantage to your employees, your firm's productivity, and your profitability, it also delivers a great advantage for chapters, because for every firm that your chapter enrolls in the program, ALA will allocate 50 cents per employee per month for the chapter to use towards any ALA program or service. So for things like conference scholarships, webinar registrations, publications, and the like. As an example, Teresa, who's joining us today, Waller Lansden has 381 employees enrolled in the program. They recently signed up. And as a result, the Middle Tennessee chapter will have nearly $2,300 allocated for its use towards ALA products and services each year just from that one firm. This is going to provide a great advantage to your chapter members and hopefully enhance the value of membership in your chapter. And as I mentioned, Teresa is joining us today on the call, and we'd like for her to share her firm's experience in getting enrolled. So, Teresa, we're looking for you. There she is.
Hello, can you hear me?
Yes, we can.
Great. Good morning, everyone. Teresa Walker here. I'm in Nashville, Tennessee. I'm with Waller, Lansden, Dortch & Davis, and as Oliver mentioned, we have just recently signed up with the Teladoc program. Of course, learned about the program really right before the annual conference when the new benefit was added through the GLJ folks, and very excited about it. This year, our firm became self-insured for the first time in many, many years, and as soon as I heard about the benefit and the opportunities that it offered for our attorneys and their dependents living in their homes to get this sort of health care service kind of on demand, 24/7, 365, I knew that that had great potential to drive health care savings for our law firm in particular. So we have recently completed sign-up. We're not effective yet, but here in a few weeks, I'm hoping by August 1st we will be effective. We had the opportunity to meet with the Teladoc medical director actually earlier this week. He lives in our area, and we're very impressed with the information he gave us about the program, the number of people that they have covered across the country, the size of companies that they have covered, and just the great success that they are having with the program, and the fact that this group has been in place since, I believe, 2002. And they are in all 50 states, board-certified physicians in all of those states. In our area, in Tennessee, they have roughly 18 to 21 physicians in their network here who are actually resident in Tennessee. So if one of our employees actually determined they wanted to go and see this physician, the physician that they got through the Teladoc referral source. Each of these doctors actually is in brick and mortar, at least in Tennessee. I don't know that to be the case in all states, but at least here they all have practices, usually on about a 50% basis. So they're seeing clients routinely in their offices, and then also in addition to that, they do the video consults or the phone consults as well. So as we discussed it here in our firm with our chairman and with our benefits group, we just saw this to be a great opportunity, mainly to provide a service to our employees and family members that we feel like will be a huge benefit to them. We all know attorneys get very stressed. They live their lives working under stressful deadlines, and every hour they feel like they take away from billing responsibilities is an hour that's kind of lost to them. So we see this as a great bridge to give them opportunities not to have to experience those loss of billable hours dealing with the flu, or maybe it's children who have gotten sick, that sort of thing, through the use of the Teladoc system. So we're very excited and thrilled that GLJ has brought this product to ALA, and all the additional benefits as far as driving opportunities for chapters is that's kind of icing on the cake from my perspective as the Chief Operating Officer of our firm. And we're a firm of about 200 here in Nashville, but also have offices in 3 other locations and in 2 other states. So I would highly recommend it.
Thanks a lot, Teresa. And as Teresa indicated, the enrollment process and onboarding for the program is really easy, and the folks at GLJ are here to help you all along the way. And so I'll turn it over to Alan and Charles to talk to you a little bit more about the program. So, Alan?
Thank you very much, Oliver. This is Alan Wilson. I'm the National Program Director for GLJ, and I have Charles Carlson here with us. Along with our entire GLJ team, we're huddling in our conference room because it's 112 degrees outside, and we're all thinking about calling Teladoc ourselves for heat stroke. So just thank you so much, Teresa, for also joining us. You know, I wish I had that Nashville accent that is just so sincere, and we wanted to first of all thank the ALA leadership team, especially Oliver, who led the charge on this for the last several months in bringing Teladoc and this ALA exclusive and specific telemedicine program to ALA via Teladoc. It was a great process. The one thing that Oliver insisted and his team insisted that we do when we put this together was that we try to figure out a way that we could benefit all of the chapters. So we've figured that out. We've figured out now how a VIP business partner, GLJ, through Teladoc in this program can support all 98 chapters in what we do with this program, and all size law firms. Regardless of size, this program is available. Oliver started out, as we always like to with these programs, started out this morning with the why, and that's always so important, is to talk about the why and to start with the why. Now we would like to focus on what it is. What do we have? What are we talking about here today? What have we designed exclusively for ALA, and what the program is with Teladoc. As we go through the program, when you hear the word employees, we want you to keep in mind that this is also a program designed for your part-time employees as well. So let's keep that in mind as we go through. Our objectives today are to show you what the program is, answer any questions at the end of the presentation, and hopefully motivate you as the chapter president and a leader to get behind the initiative with your individual chapters and your chapter boards. Please ask questions by text as we go along, and we'll get to those We'll get to those at the end. We will provide all of the tools, the materials, and resources to help make this a success for your chapter and for your chapter firms. This is not a sales presentation. However, we are hiring Oliver and Teresa directly after the call because they did great. But if you are interested, certainly as a firm, as you hear this, go ahead and contact us separately. But we wanted to show you this program so you can take it back to your chapters right away. You'll hear more about it at CLI. There'll also be a national call in August for all members. So with that, let's go ahead and show you what we have and what it is. I'm going to turn the time over to Charles Carlson with our team here. Charles?
Good morning, everybody. I echo what Alan just shared, and that is Oliver and Teresa did a great job of really sharing the attributes and the benefits of Teladoc. We're very excited to share more details about the program with you this morning, and very much looking forward to supporting all of your members and their employees and their families with this benefit in the future. So the Teladoc program, and some of the things that make the Teladoc program to ALA unique, is that this program provides access to your employees and their family members, basically unlimited access to a provider or physician 24 hours a day, 7 days a week, 365 days a year. There's no co-payment connected to the encounter, so when the member calls and consults with a provider, they have no financial obligation that's paid out of their pocket for that consultation. There's no setup fee that the firm incurs in actually implementing the program, so the program basically is a very simple implementation and a very painless process in being able to adopt the program. As Oliver indicated, it's a $7 per employee per month fee. This covers all the members of the household, so this is not a per belly button charge. This is something that covers every member of that family. So what is Teladoc? Teladoc, again, as was indicated, is access to a provider 24 hours a day, 7 days a week. These are U.S. board-certified physicians, and they can diagnose prescriptions for basically short-term type conditions. And Teladoc itself as an organization was founded in 2002 and is the largest telemedicine provider in the country. The way that our clients use Teladoc is that when they initially call in after they've set up their records with Teladoc, is they basically contact Teladoc to arrange for a consultation. Once that arrangement for the consultation has been made and they basically establish that they want to have a priority call with the provider will return the call to the member after the initiation of that intake call. What we're experiencing right now at the present time is the average turnaround time between the time the member initially calls to the time the doctor actually calls them back is running today at about 8 minutes. So it's very quick and it's very efficient. There's no time limit when the member contacts the doctor and isn't in a consultation with the provider. The provider will take the time necessary to be able to diagnose and dialogue through the conversation with the member as they're in this interactive relationship. Basically, from the results of the telemedicine or the Teladoc encounter, 90% of the members' issues are typically resolved during the Teladoc consultation. So it has a very high rate of success. And so I'm not advancing here, Alan. Let's see what's going on. Okay, here we go. So after the consultation, there is a review and a survey done by Teladoc of the members who use the service. And 95% of the members say they're very happy with the use of Teladoc, and 92% say they'd use Teladoc again. An important aspect of the service is when the consultation's completed, again, the member settles up their encounter and their visit, and there's no co-payment, there's no financial responsibility on the part of the member, and as Teresa indicated, there's no bill that's generated to the insurance plan. So within that $7 per month fee, that covers all of the services associated with the Teladoc program. The provider, after the consultation at the employee's request or the member's request, can also send a transcript of the consultation to their primary care provider if that's something that the member requests. So some of the times that our members are using Teladoc are, for a lot of various different reasons. We've only put a few examples of when a member actually will use Teladoc. They use Teladoc if they're traveling or if they have a need for immediate care and don't really want to go to an urgent care facility, or perhaps want to consider this in lieu of an emergency room visit because really, they don't need an emergency room visit, but they've been accustomed to the convenience to access care directly through that channel. So it's really trying to train people and help them to understand that this is an alternative form of care that's available to them, and it's a very convenient form of care that they can use for a variety of different reasons. Some of the most common conditions that are treated by Teladoc include general health issues that might include things like, flu symptoms or allergies or pink eye, urinary tract infections, dermatology conditions that may, occur or pop up that might involve skin infections or acne. An individual can actually take a picture of their skin condition, upload it to Teladoc, and the provider can review that during the consultation. They can also call with certain behavioral health issues if they have any kind of anxiety issues that have occurred or need somebody to talk to or want a consultation with somebody. Immediately a Teladoc provider will be available to talk to them. So there's a whole variety of different reasons why a member can access the services of a Teladoc provider. So the differentiators of the ALA Teladoc program are all members of the household are covered, so within the $7 per employee per month fee, all of the members of that household are covered. The program has no copayment. The bill does not apply towards the deductible because there's no payment required by the member. And again, there's no bill that's generated to the insurance plan, whether you're fully insured or whether you're self-insured. Unlimited consultations. A single individual could use this, 15 times. A family could use it 30 times during the year. There's no restriction. There's no cap on the number of times they can actually use the service. 24-hour a day, 7 days a week, 365 days a year, access to board-certified, U.S. board-certified physicians. And the program is very affordable at $7 per employee per month. As you look at this service and benchmark it elsewhere, you'll find that this is a very competitive rate that's being offered to the ALA. So how Teladoc saves you money and will help save your health plan money is it really will help, and you'll experience a curb in unnecessary utilization against your health plan because it provides a very convenient and easily accessible alternative to an urgent care visit, office visit, or emergency room visit to your members. What we have seen is that when members have traditionally sought care, 8% of the members typically will seek care from an emergency room visit, 42% seek care from an urgent care facility, 1% go to a specialist, 38% go to their primary care physician, and 11% do nothing. So the average cost savings an organization will actually see or experience is roughly about $191 per episode when they use the Teladoc program, or $2,600 for an emergency room visit. One of the things that you'll see as we enroll you as a Teladoc client is that on a quarterly basis we'll send each of your firms a utilization report that will show you the usage of your Teladoc program. What we're seeing in the savings or the ROI of these reports is running around a 12-to-1 ratio of the average savings that the Teladoc program is generating. One of the reasons why it's important for us to send this report out to you is we really want to work together with you to encourage and ensure that you're getting the message out to your members that this is an available service to them and that they, in fact, are continually reminded of being able to access the Teladoc program. This program is only going to be as successful as you, as administrators, really promote this internally within your organizations and make your members aware of the program. So we have a number of different things that we do to encourage that include worksite posters, payroll stuffers, various different email announcements, and those are things that we want to work cooperatively with you in making sure that you've got all the tools and resources to continue to highlight this benefit throughout the year, and we can't emphasize that enough. And really, really hope that you'll, work cooperatively with us. We'll be here to help you in supporting you to do that throughout the year. Very, very important aspect of the success of the program. So how Teladoc will help your plan if you're self-funded is your employees will have an alternative to a doctor's office visit or an emergency room visit or an after-hours clinic. There's no co-payment to the employee, and so again, that's money that stays in the household of your employees who, now can use that money for other purposes that, may be more beneficial to them. If you're fully funded, it reduces your claims utilization, which helps curb your cost trend, which may potentially have a positive impact on your renewal as you come up with your carrier annually. Some of you may also have high deductible plans with your employees, which, this program, providing it as a supplement or an adjunct to the coverage you currently provide, provides your employees actually a first dollar benefit within your benefit offerings. So the return on investment solutions with Teladoc to an organization include quick access care, which on average, what we're experiencing overall, if we look at our annual average, the callback response rate is about 16 minutes. You'll experience a reduced overall medical spending against either your fully insured plan or your self-insured plan. And organizations are averaging about a 12-to-1 return on investment ratio. Saves time for both the employee and the employer, and the results are that 94% of the consultations with Teladoc are typically resolved during the first call, and the Teladoc can be used anywhere in the United States on work or travel or on vacation. It increases employees' presenteeism, as I think Teresa indicated in her initial discussion. And so as we look at the metrics of this and we look at where the potential ROI is and where we have the opportunity of being able to help our clients, we're typically seeing that on average it takes about 4 hours for an individual to seek medical care, whether it's through urgent care, the emergency room, or their primary care provider. We typically will calculate about a $19 an hour wage rate when we're calculating the lost productivity, and as we're calculating the savings that the Teladoc program actually realizes. It improves workplace productivity, and members who have used the program say that they would use Teladoc more than once. It's also a very attractive benefit as you introduce the benefits that you offer to your employees, whether that be to a new employee or your existing employees. You'll find that this benefit is something that they really will understand and will embrace, and will actually have quite a bit of excitement over it being introduced to the organization. Employers are rapidly adopting telemedicine into their benefit offerings, and we're seeing that in the rapid expansion of the Teladoc organization's growth. And so we really think that you'll experience positive feedback from your employees when you introduce this to them. Again, it'll help your organizations, your firms manage risk, do that more effectively, and redirect some of the care that's going to urgent care facilities or emergency rooms to a much more cost-effective solution to the organization. So we appreciate the opportunity of being able to share with you some of the benefits and attributes of the Teladoc program. We're very excited in being able to work with you as chapter presidents and being able to work with each one of your individual members. We're here to answer questions with anyone who wants to, reach out to us as they look at this as a potential benefit they want to add to their organization. And we'll take whatever time is necessary to fully support each one of you. So thank you again for your time, and I'll turn this over to Alan.
Okay, back to Oliver.
Thanks, Charles. Again, we hope all of you will find this program to be a great advantage to your firm's productivity and the bottom line, and that you'll also take advantage of the opportunity the program provides for your chapters. Again, for every employee of every firm enrolling in Teladoc, your chapter will get a credit equal to 50 cents per month per employee for as long as they're enrolled in the program. So not only will your members' firms get a great new benefit program, your chapter will have access to more funds to deliver things like scholarships, publications, and other resources to them as well. I think we have a few minutes left, and I believe, Alan, you may have some questions from the audience, so I'll turn it back over to you guys.
Thank you, guys. It looks like we have a question. Is this a regional plan? Are the physicians located in Florida, or are they from other parts of the country? How many physicians are employed by Teladoc? So let's go ahead and answer that.
Yeah, all the physicians that Teladoc uses are either employed or contracted, and they're all board-certified providers. And each of the providers that provide the services, whether somebody's on travel or resides in a particular state, is being provided by a physician who's licensed within the state in which they're performing the consultation. So if you have someone who, resides in Florida, that'll be a Florida provider. If you have someone who's in travel somewhere else in the country, and they happen to, need to use Teladoc in their travel, they'll work with a provider who is licensed in that state in order to provide that consultation. So these are providers located throughout the entire United States.
Okay. Are there any other questions? Looks like we've got a question that just came in. Are there any international capabilities?
Yeah, at the present time, there is not, but it's an evolving program, and but at the present time, no, there are not.
Okay. Any other questions from the group? Can you add partners of the firm to the plan?
The employer is going to designate who their eligible class to participate in the program is. So if the firm designates that partners are an eligible class that they're going to offer the service to, then they simply, at the time they provide us with their enrollment data, will provide us the information on all of those who are going to be eligible to participate, so as partners can be added.
Okay. The next question is, can this benefit be offered only to those who want it, or is it a full buy-in from the firm, all members necessary?
Okay, so the program is not a voluntary program. This is a program that's paid for by the employer. However, the employer designates the eligible class. So the employer will designate which class of employees are going to be eligible to participate, but it is not a voluntary payroll deducted program.
Okay, another question. Once you join, how long does it take to access?
The length of time to implement your group is, we would like and would prefer a full, hard month in being able to implement your group, and the reason that's important is we will actually send new member kits to each one of your employees' homes. The new member kit will have information on how to access the benefit and provide all of the appropriate telephone numbers and ID numbers to the individual. However, if there's a firm that requires access more quickly, please just contact us here at GLJ. We will work with you to discuss how to potentially assist you.
Okay, one of the other questions that we have here is to get a copy of the presentation for the statistics, and also there was another question that said, or a statement that was, the information on the partners being eligible would be important for taking it to your boards or taking it to management for approval for a firm. Right after this call, we're going to be sending you a packet of the information relative to this discussion and relative to the program, as well as a video. We think that will be helpful. There are statistics that are included within that packet. If there are any other statistics that you're looking for, and we'll take the individual slides for the statistics. We'll also send that to you as well.
And we'll also make this presentation available on demand through the website, so you'll be able to take a look at this and share it with others if they're interested.
I really want to emphasize that what you'll see when you see some of the videos, or just if you look at some of the marketing literature in general, if you look at this, outside of this discussion and what we're talking to you, as ALA members, is you'll sometimes see references to co-payments in some of the generic material. The ALA program has no copay. I emphasize that it has no copay. So no matter what you may see in a generic video where perhaps it may refer to a copay, this program does not have a copay connected to the service.
So there was one other question here. We already have Teladoc through our insurance broker. Can we get a chapter benefit and lower costs somehow? This particular program is not available through your broker. It's only available exclusively through this GLJ ALA Alliance. So you have to buy it directly from ALA to get the cost savings, and also to be able to get the benefit back to your chapter, as well as getting the no copay and the unlimited calls and the no setup fee. It has to be accessed directly through this ALA VIP program. How many ALA firms have joined? Since we rolled this out at conference, we've had interest from over 300 firms. We are in the process currently of contacting every one of those firms. We have probably 2 to 3 dozen right now that are active in signing up, and are somewhere within the process of signing up for the program. This is really a systematic launch. We mentioned it. We mentioned it at annual conference. You'll see it all over the Business of Law conferences. This is really our national launch here today on the call with ALA chapter presidents. The all chapter leadership will see it at CLI. We'll also have a national call in August. You'll also begin seeing some information and some informational ads in legal management. So we anticipate a big uptick. We have just here in Arizona we have probably 100 to 150 of our clients already on this. We tested this tried and true for over a year before we brought it to ALA. We're receiving no complaints, and that for me, and for certainly our group here, that's a tremendous testimony to the program. So that is the answer to how many ALA firms have joined so far.
I'd like to add a couple of the questions that have been asked earlier, and that is that if any of you have any unique considerations, we will do everything that we can to, assist and work with you. So just contact, us over here at GLJ and dialogue through what perhaps your unique circumstances may be, and we will work with you and, seeing how or what we can do to accommodate or assist you. The program is very easy to use, and again, the value that the employees receive from this way outweighs the actual price that the program costs you as a participating firm.
So do we have any other questions? Okay, I'm going to wrap up just with a couple of other fun facts. We mentioned part-time employees on this particular program. Current part-time employees that are within your firm that are not currently covered by your health plan and are not paid for by the employer can be now paid for. This program can be offered to them by the employer as a benefit. So it becomes they can be put onto the census, and it's not an issue putting this on because this is a service and not an insurance program. And it is all 1099 employees as well. If you have 1099 employees and contractors, they would be eligible for this program also. So if you have 1099 or part-time that currently don't have anything, the employer can include them for $7. So I think it's important that we point out the affordability of the program. I had a conversation last week in Las Vegas with a firm, and the administrator said to me, well, gee, I guess I could probably buy a venti latte once a month for all of our employees and have donut day, or I could get 365, 24/7 access to a board-certified doctor, and I think that's pretty cool. We do have two more questions. With the cost of health care rising and changes in law, do you think having this system will impact future health insurance premiums by lowering costs?
Yeah, we see clients using this in a lot of different ways. In fact, we will, attend enrollment meetings where the employer has actually looked at other plan alternatives, whether that's, a plan alternative where they've been able to increase their co-payments or increase their deductibles in order to create a reduction in some of their premium expenses. This, of course, does have an impact on your utilization, but what we find when we introduce this to a group where the employer has had to make changes because of their increasing costs and take a plan where they've had to increase the co-payment or the deductible, they're providing a first dollar benefit by introducing Teladoc for only $7 a family a month. And so where the plan may have changed and imposed a little bit more financial liability on the employee, by introducing the Teladoc program with no co-payment and no out-of-pocket expense to the employee, employees very enthusiastically receive this added benefit, even in the face of some of the other changes their employer may present to them.
It's lowering insurance premiums for the firm by lowering costs.
Right, because it's lowering the premiums to the firm by lowering the costs. So.
Yeah, specifically what it attacks and what attacks the lowering of costs is the curbing of utilization. So the ability to be able to access Teladoc and not be accessing an urgent care facility or, let's say, an emergency room facility, the costs to the plan significantly are impacted. Now that's tracked, remember, when you get your quarterly report, your quarterly utilization report, that is, you can track that very, very easily, and that's very useful when it comes time to review your renewal. We have another question here. Is this a benefit that needs to be reported in conjunction with our health benefits for the Affordable Care Act?
We do not see at the present time where this needs to be connected to the reporting requirements of the ACA.
Okay. Any other questions? We thank you very, very much for joining and taking time out of your busy day to learn about this benefit and this program that we have developed and designed specifically and exclusively for ALA. We look forward to hearing from you. We can be reached at 1-800-892-8826, or we can be emailed here at, you can email Alan, A-L-A-N, at GLJinsurance.com. Alan at GLJinsurance.com. Thank you very, very much for your time, and thank you to leadership, and we'll look forward to discussing this more, and we'll see you at CLI. Thanks.
Alan?
Yes.
Hi, Alan. I just wanted